moving right along still. We're now doing the delivery of the baby. So this would be stage 2 of the labor process, where we're going to be doing the delivery of the baby, and then we're going to follow up with delivery of the placenta. Okay, so before I go ahead and get my patient, before my patient is anywhere near 10 centimeters, obviously we want them near it, but before they get to 10 centimeters where they're ready to push, we're going to make sure we have the delivery room set up, which includes the delivery table, which is the sterile gloves, the sterile gown, the clamps. All those things are medications that we're going to be using in the delivery room and for the physician. So we would go ahead and have all that set up, but we will not have that in the room, and we will not have it uncovered until our patient is coming in and it's ready to be used, just so it can remain sterile and that nobody accidentally bumps into it or knocks something off and the entire tray is trash, basically. So we would go ahead and do that. Once my patient's at 10 centimeters, we're ready to push. I would go ahead and uncover my delivery table, making sure all of the things are in order of what my physician will be grabbing as he's going to get ready for the labor. So we're going to go ahead and do the vital signs of the patient, making sure she's nice and calm and comfortable. Super important that at this point, the epidural catheter and not the epidural catheter, but the epidural drip should be stopped at this point because she's now ready to push. There's no epidural should be coming out. So we're gonna go ahead and prop her legs up, making sure that we can get her nice and comfortable into the stirrups so she can go ahead and get her baby into the world. So once that's done, I'm going to be looking at the placement, looking at the positioning of it, making sure I don't have a breached fetus, because we would hate to give birth to a breached baby. I've got my medication, I've got my Pitocin, I've got my lactated ringers, I've got my Narcan and my Methergin all ready to be given to my patient as soon as she's done delivering the baby. The Narcan's going to be there obviously for the baby just in case. And everything else is going to be for the mama. Okay, so now that we've got that, we are ready to push. We're ready for the baby to come on out. So we're going to go ahead and have her push the baby out. The baby's come out now. The nurse, the midwife, in this case I'm going to speak in reference to myself, I would go ahead and grab the baby, dry the baby off, making sure, another thing that I forgot to mention is we're making sure we have the warmer warmed up to 37 degrees Celsius prior to this so that all the towels and things can be nice and warm. So we go ahead and put the baby on the warm towel so they don't get thermia or anything like that. I'd go ahead and use my bulb and suction it, and at this point I can also place one on the chest of the mama, and I can go ahead and put the baby there for a little bonding moment. But we're going to do all of that after we have suctioned the baby, making sure that the baby is responding. I would go ahead and do my APGAR at this point, suction my baby. I would go ahead and take vital signs, and I would also be putting my armband on my baby, which I got here. These are my actual armbands from when I was a baby, but I can go ahead and put my armband, and then we can go ahead and do the footprint sheets. All of these are going to be done and placed on the baby and on the mama. Another thing that's super important that I failed to mention is that prior to this, we're going to be making sure our patient's O2 is being monitored constantly, and we're also going to make sure that the entire respiratory setup is good and working for both the baby and the mom, which will be like an ambu bag on hand, a nasal cannula, a non-rebreather, whatever the case may be, just in case. So once we've got our armbands on and we've gotten our footprints done, we can go ahead and grab the cord blood from the baby. Usually a nurse could do that, or the physician, if they have time, they would go ahead and grab the cord blood, get the sample, go ahead and get the sample sent to the lab. And then we're just going to be monitoring the baby. We've got the baby all cleaned up. We're going to keep suctioning it. And then now we're waiting for the placenta to be delivered. Again, super important to make sure the placenta is delivered intact. Once the placenta has been delivered, we're going to look at it. We're going to assess it, making sure it's intact, making sure it's come out as a whole, and nothing is left inside of the patient. If it has been, we would have to manually go in and grab whatever is remaining of the placenta from the patient so that it doesn't cause any harm to my patient. So once we've got that all done, we've got our cord blood drawn. We're gonna make sure our patient's nice and comfortable. We can go ahead and put the bed back down. I'm gonna go ahead and clean her up. At this point, she would go ahead and begin getting those medications that we already had set up in the room prior to delivery, which would be the Pitocin and the lactated ringers. We would go ahead and give that to her. There was no need for us to use the Narcan, so we can go ahead and waste that, and the Methergin, so she would be getting for bleeding. She's got some blood. There's going to be some bleeding there. Not always is it going to be a lot of blood, but there's going to be some bleeding. She's got some bleeding, so I gave her the Methergin. She's got the Pitocin and the lactated ringer solution mixed together. So now we're just going to assess her afterwards. We're going to assess her vital signs again. We're going to make sure we're doing her vital signs every 15 minutes. And we're also going to be making sure she's nice and comfortable. I can go ahead and make an ice pack to kind of soothe this area down because it's going to be on fire once she's delivered the baby. Make an ice pack, and just super important to make sure she's comfortable because, again, after labor, she is going to be exhausted and she's going to be very uncomfortable and in some pain. While we're doing this, we're going to also be monitoring the baby. We're going to be monitoring the fetal heart rate, making sure the baby's okay, making sure there's no difficulties with the baby, and everything's good with that, and they're going to be okay. We can leave the baby with the mom for them to hold just to have their moment together. And once that's done, I can go ahead and remove my patient from her stirrups. I'm going to go ahead and assess her fundus again to see if it's swollen, see if it's hard. I'm just palpating it. And there's a little tenderness here and there, but she's okay. So my patient's nice and comfortable. She's resting now. We've cleaned her up. Her baby's over in the little incubator. He's resting. And at this point, another thing that I mentioned is I would not, when I'm doing my armband and my footprint sheet, like this says it's a girl, but I would not put the sex of the baby until the end, until the baby's delivered, because sometimes you never know. So I could just label their name and the date, and then I would obviously put the time, the weight, and the length, and all those things. Another thing that I would be doing once the baby is delivered. So that's about it with my helping with the delivery. Thank you.